Are we on?
You're on.
Good evening, everyone. This is my name is Bev Wood, and welcome to our monthly condition workshop. We're really happy to have all of you here and all of you out there with us tonight. This month, our workshop will be on ADHD, and we're really privileged tonight to have a guest speaker, Kimberly Lauger. She is a registered nurse. She is a certified handle practitioner, which I'll let her tell you what that is. And she also is the owner of the Redtail Neurodevelopmental Center here in Tucson. So let's all give her a real good welcome here and have her come up and present for us.
Thank you for having me. I appreciate it very much. And well, they asked me to come and talk about ADHD. Really, I have no experience with BioTouch and ADHD. I have my own personal history with ADHD, as many of you probably have. So I was trying to decide where we really wanted to go with these introductory comments. I made myself some notes so I could kind of stay on topic and not just ramble endlessly. But first off, I'd just kind of like to know you, and then I'll tell you a little bit more about myself and we'll get started. So Rebecca, you want to start?
Sure.
Like, what's your interest in ADHD, why you're here tonight?
Okay. I'm Rebecca Park, and I have a 9-year-old daughter last year.
Okay.
Hi, I'm Rondi, and my 38-year-old daughter has it.
And when was she diagnosed?
About 5 years ago.
So as an adult.
My name is Barbara, and I have a grandson in his 20s who is not that, but he has Asperger's, and I thought there's got to be some similarities there. So
There's definitely some overlap.
I thought I'd try it.
I'm Jan, and I have a 7-year-old grandson that's been diagnosed with ADHD.
I'm Susan Cooper. I'm a retired special ed teacher, and I have a grandson whose parents are very much in denial. He's almost 4, but it looks very much like ADHD. And his father was ADHD diagnosed all through school and drugged.
You had the medication.
Heavily. So I have a lot of interest in it. And also, I don't know if your field also takes you over to concussions, but I have a daughter has a very bad concussion right now.
Recent?
October.
Okay.
Well, I'm here because I'm here.
You're here. Thank you for being here.
We're all here because we're here. Yeah.
All right. So my name is Kimberly, and I am a neurodevelopmental practitioner. I am trained in an approach called HANDLE, which is holistic approach to neurodevelopment and learning efficiency. And what that really means is we want to know how we can make our brain and our body work more efficiently for us. And you can put a variety of different labels on that. You can call it traumatic brain injury, you can call it autism spectrum, you can call it ADHD, we can call it age-related memory loss, we can call it stress, but we all know that there are different times that we are able to focus more efficiently than others. And so what are the things that are going on inside of us and around us that influence that ability to attend? So and I will say that, I started out as a 19-year-old sitting my boards as an RN. So I've been a nurse for a very long time. Worked in pediatrics my entire career, or adults with developmental disabilities. But I say that my learning really is driven by my children. So my oldest son is 30 now, and he had what I call attention and learning difficulties growing up. And it was a very great challenge to figure out how to meet his needs. Here's this brilliance, and here's this struggle. And how do you put those two things together so he could function efficiently in the world? That E in handle, efficient. You can be effective, but when you're efficient, you can do it and not use up all your energy, so you have leftover reserves to do the other things in life that you care about. Kids who struggle, or adults who struggle, don't have that. They spend all their energy just getting through the basics of day. It takes so much more effort to do that. So I learned a lot from Tyler. And in the educational system, Tyler carried the blame, or was given the blame for his difficulties. If he wanted to pay attention, he could. If he wanted to get his work done, he could. If he wanted to read better, he could. If he wanted to write better, he could. As if it was all just a choice. If he could just decide to have it go easier for him, then obviously he would, because he was so smart. So why else wouldn't he, other than that he just decided he didn't care? And I always knew as a mom that that was wrong, because I was the one at home with him and saw him struggle 6 hours a day trying to do that work. So he kind of led me in that passion of how do we help people be understood and supported rather than blamed. And then I have a middle daughter who's 28 now, and her sensory systems are very efficient and effective, and she can be completely flexible in the world. She can decide what she wants to learn, and she can get it done pretty well. And then I have a son who has a syndrome, and he's deaf, and he has very limited vision, and he doesn't speak with words, and when you see him, you think autism. And he's taught me a whole nother realm of things, and he's the person who led me to handle. So when you talk about ADHD, what do you think about? Is it a biological condition? Is it a psychiatric condition? Is it a behavior? What do you think when you think of ADHD? Just the people here.
Biological.
It's biological. Would everyone agree with that? Mm-hmm. And why does it matter if it's biological or behavioral?
Biological is something you have to learn differently, and the other is that they can't.
Right. So with the biology, you recognize that there's something physiologically going on with this individual that is slightly different than in somebody else who doesn't have ADHD, and that difference is influencing how they function in the world. When you don't recognize the biology and the physiology, then you think, like with Tyler, that he could just decide to do it differently.
Is ADHD always biological? The diagnosis?
The diagnosis is based on behavior. Okay? So I'm going to look at my notes so we can go by what the experts actually say. Okay? Because I can tell you anything from a handle point of view, but we'll start with the CDC. So attention deficit activity disorder is a biological disorder that causes hyperactivity, impulsivity, and attention problems. In a journal from Italy, recognized it is not a single pathophysiological entity and appears to have a complex etiology. What that means is it's not the same in everybody. We can't say just one thing causes ADHD any more than we can say one thing causes autism spectrum disorder. Right? So the people from Italy, I really liked how they talk about the neurobiology of ADHD. So we know there are genetic factors, we know there are environmental risk factors, and all of those things by themselves might have one small individual effect. But when you put them all together, they have a profound effect. So some of the things that we know are that the brains are smaller. Particularly, there's impact in the prefrontal cortex, like your executive function, your thinking brain. In the basal ganglia, which is kind of where you might have people who get stuck on a thought or an idea and lack some cognitive flexibility. Anybody relate to that? Yeah. And the cerebellum. So in nursing school, we used to talk about the cerebellum as the place where it just kind of helps us put together and organize our motor movements. It was 1985, and they really started talking more about the integrative effect of the cerebellum and how it integrates sensory information. And so it has a large role in ADHD. Initially with ADHD, we looked at the connectivity between two sides of the brain. How do you get messages from left hemisphere to right hemisphere and back and forth? And the easier those messages go back and forth, the more flexible you can be in the world. The more you can take in information and just respond to it. But if those messages are getting stuck, then it makes it a little more difficult. And then the impact of dopamine, one of our neurotransmitters, which is our reward neurotransmitter, the cha-ching, I did it reward kind of pathway that is impacted in ADHD. It's the part that says, I can do it if, like, Tyler was a kid who, if you wanted him to do his chores, he was not going to see the level of detail of that chore in the same way as I might see it. So his perception of cleaning the bathroom and what I perceived as a clean bathroom were not necessarily the same. And so breaking that down into concrete steps for when you clean a bathroom, this is what you do. First you do this is what you do this is when you do this. And not just like clean the counter, wash the sink, wash the toilet, etc. Steps for cleaning the sink, steps for cleaning it. And then what do you have at the end of all of those things? You put up the structure to help him be successful, but what are you going to have at the end? Reward. You're going to have reward. Do you notice for kids if they have homework and it's tedious homework and it just seems like busy work, does somebody with ADHD have an easy time with that or a hard time with that? A hard time. They need to know and feel like what is in it for me, why. And that's not about being lazy and unmotivated. It's because they need that to get the dopamine level going and to get that communication up to their thinking brain. That's why people with ADHD like Tyler grow up to be awesome paramedics, right? You get all that adrenaline going, you turn your brain on, but without it, and it's just the mundane, it's much, much harder. So to get diagnosed with ADHD, it is diagnosed as a psychiatric condition. The diagnostic criteria are in the diagnostic, how do you say it? DSM-5 is the current version. And in that newest diagnostic criteria, they moved it to a neurodevelopmental disorder, similar to autism spectrum, rather than a disruptive disorder like oppositional defiant disorder. So it's in a different place when they diagnose. And if you're younger than 17, you have to have 6 of 9 inattentive and or hyperactive impulsive features. And they have them all listed. Like, what are some of the things that you would see for inattention? What do you guys know what they are?
You can't control them.
So there's
He
the
takes
hyper
off.
part. He's on the go.
Yeah. And
He's
you run out
running.
in the street. You're
Gonna run in the
just
street.
without looking and then just without thinking about it ahead of time.
Yep. Hyperactivity, impulsivity. What else do we see?
Not being able to stay on a task.
So keeping your focus on something, particularly if it's challenging. Emotional dysregulation. Mm-hmm. So the doctor has to look and see all of these things, and then they have to see if they have enough of them. You have to have those symptoms for at least 6 months, and they have to be inconsistent with your developmental level. You can't expect a 4-year-old to do what an 8-year-old does and say, oh, he has ADHD because he can't function like an 8-year-old. That doesn't work. And they used to have to say it has to occur in 2 or more settings. And it has to have an influence in both of those settings. For adults, the diagnostic criteria, it's fewer of those areas being influenced. Why do you think that is? They've learned to live with it and manage it. So some of those things that might have bothered when they were younger, they figured out routines and systems of how they cope with it, and so it may not be such an issue. And neurodevelopment does happen, and so some things do become easier over time. And what's the treatment for ADHD in the medical system? Ritalin, medications, sometimes cognitive behavioral therapy. So you over here are talking about little guys. The treatment, the first line treatment for a little person with ADHD is behavioral therapy. Teaching the parents, teaching the child. You do not start with medication. In practice, that is not always the case. When you're older, more of a school-age child, they may medicate first, recommend that you're doing both at the same time. But with the preschoolers, you're really recommending that behavioral therapy before you move into medication. And for adults, what does behavioral therapy look like? To coach. Adults with ADHD can have a coach that kind of helps them through all of those tedious things that aren't triggering your frontal lobes to just automatically take care of it. So they can put some of those systems in place that build in your own reinforcements, your own way to get the dopamine going. So a coach can be very helpful for adults with ADHD. So then, how many people remember being little and hearing the ice cream truck come by? And what happens when the ice cream truck comes by and you hear it as a little kid? What happens? You run into excitement. Excitement. And what do? You either go out or you say, Mommy, can I have some money? Right? But you respond immediately to the sound of that ice cream truck. And so what happens in our lives is we all want everybody to respond to stimulus as quickly as the ice cream truck. When the teacher says, put your papers away, or get your book out, or turn to page whatever, or read this aloud, or whatever the stimulus is, we expect the ice cream truck response. But that's not how it happens. When we process information, my little brain here, information is coming into us through our sensory systems. It's coming in through our eyes and through our ears and what we feel and what it's like to move and the sense of in our body, with taste. All of these things are coming together and coming up through our peripheral nerves and our cranial nerves, up through our brainstem, and they come to this area of the brain called the thalamus. And the thalamus has this very important job of gathering the information from 11 of our 12 cranial nerves and making sure that that information makes sense and that we're safe. One, is it safe? And two, do all of those sensory experiences fit together? If I if I feel a snake and I see a snake and hear a snake, does all of that match as compared to if you're feeling something, seeing something, and hearing something else? That experience is very stressful to the body. If anything that has to do with our survival, this thalamus is going to send that information down to our hypothalamus. It's going to send the information from the hypothalamus down and trigger that fight, flight, stress response in our bodies. But it starts with how the information is coming in. If the information is coming in an organized way and our body knows what to do with the information and there's no stress involved with the information, it goes up and it goes to our cortices. And when we get information up to our cortices, what can we do? We can think, and we can talk, and we can plan, and we can reason, and we can have good judgment. But if there's any interruption in this pathway, then it's going to be more difficult. Then I have this little picture of a neuron, which is a brain cell. So if you picture this is your cell body of one of the many millions of neurons in your brain, and you have all of these little dendrites which are having communications with other neurons. And then you have the cell body, which is like an electrical wire. The information is here, and it's going down this wire, going out the other end, jumping across a gap, which we call a synapse, and connecting with other nerves. Okay? So just like an electrical stimulus, you want information or electricity to come in here and move efficiently down this wire and out the other side. If you have shorts in the wire, you get a little bit of erratic communication. So to prevent shorts in your wires, what do you do with them in your electrical system? You insulate them. You make sure they're nice and covered so that they can't just have messages popping out the sides of the wires. In our brains, that insulation is primarily made of fat, which is why when you hear about omega-3 fatty acids, how important they are, because we need to have nice fat nerve fibers to efficiently send messages down the pipe. When Tyler was an adolescent, we used this particular product called Omega Brights. I ran out of it twice. Both times, because somebody had told me about it, we started it, and his rage attacks went away. And then each time we ran out of it, suddenly there would be these rage attacks again. And he's so calm and even and loving and wonderful. But then every now and then, bam, off he would go. But with the omega-3 fatty acids, he didn't have those things. So the efficient nervous systems. So in my job as a handle practitioner, what I do is try to figure out how we help have organized going through our brains. So we want to look at how we can have repeated, organized, non-stressful information to our bodies. We want to look at each of the sensory systems and strengthen them so they can more efficiently take in information without having stress. We want to look at the impact of each of those systems, which ones are strong, which ones are weaker, and how they can help each other out, and each one do their job individually and together. But tonight, we want to talk about how BioTouch is going to help this process of organizing that nervous system impulse. So thank you very much, Paul, for having me here, and I look forward to learning from your perspective. And I do have some
questions for Kimberly?
business cards here if people want them. You have questions? Yes.
So you're saying omega-3s.
As a nurse, I cannot prescribe omega-3s. I would say talk to your doctor about it.
They don't know. They don't even been trained in nutrition.
They do know more about omega-3s. I worked for a developmental psychologist for about 10 years in violence prevention, and we did a lot of social science change. And he's where I really began to learn about neuroscience and the impact of neurotransmitters and the things that influence our neurotransmitter levels, like that dopamine level, the safety of an environment, opportunities for reward, all of these things, safety, belonging, how all of that influences our neurotransmitter levels. And so this was probably in 1996 to 2000 range. Nowadays you hear about omega-3 fatty acids everywhere. At that time you really didn't. But he was a scientist who looked at what does the research say about things that are helping. And there's so much information about omega-3 fatty acids and the influence on our cardiovascular health, but also our brain health. So to that a little bit more, but I always say recommend talking to your doctor. And the reason is omega-3 fatty acids can also thin your blood. You know, if you have a tendency to have thin blood, you can have bleed. I mean, so anything that you give or take has benefits and risks, and you really should talk to people to kind of weigh those benefits and risks.
Like Nordic Naturals has a kids one that's omega-3, 6, and 9 in the same one.
So what I experienced from Dr. Embry is that our culture as a whole, we get a lot of omega-6 through processed food, a lot of 6 and 9. So the ratio between omega-3 and omega-6 and 9 is out of balance in our country. And so I prefer a pure omega-3 myself, but looking at those kinds of options.
But how do you avoid then the thinning of the blood?
As a child, it really shouldn't matter, but that is why I say talk to the doctor. I say, is there any reason that you think that omega-3s would be harmful for him? I've heard that some people with ADHD have benefit with it. Do you see that, is there any risk for my child in taking this? And so just asking that question, I think, is important.
Are there other products like magnesium or B6 that are indicated? Or
beyond my expertise.
What would you do then in Handle if one was to come to you with an ADHD child?
With Handle, I would evaluate how they process the world through their sensory systems, and I would develop a program of activities to kind of help strengthen each sensory system and help those systems work together more efficiently. Always paying attention to adjusting those activities to that person's body. So if they show any sign of stress, we stop.
Can you be a little more specific? I'm having trouble seeing. I mean,
Yeah.
I'd like to come and find out, but
So how
I
about
need
if we
to
do
know
that
what
a
I'm
little
coming
I was going to say,
to.
let's talk about handle later,
Yeah.
because I want
We've
to.
got some
Yeah.
amount of
Are we
time.
ready?
Okay, that's
Are you done with the
okay.
questions, or you have
Maybe,
one
yes.
more general question?
I have a question about the brain.
Yes.
Okay, you said that they have trouble communicating from the right side.
Sometimes.
Is that the corpus callosum that is being blocked somehow?
So the corpus callosum is the band of
That's
fibers in the
right,
middle, but there's
so-
more areas that,
So where
connections
is it
go.
blocked from the right to left? Because that's one of the major.
Doesn't really matter where, it matters what you do. Stick your
Well,
fingers
it's
together
also-
like this and go move your hands.
Because it's
Okay.
major pathways.
What happens when you're doing this? Messages are going from one side of the brain to the other. You you're stuck in your thoughts, you can't think what to do. Put your fingers together, see if you can get yourself unstuck. All right. So thank you very much. I appreciate it.
Thank you, Kimberly. Okay, wow. That was really amazing. Thank you, Kimberly, for that. I learned a lot. Yeah, so. Okay. So we're going to, tonight we're going to talk about how BioTouch can be effective in addressing ADHD. And we're going to be teaching you the basic sets of points using the BioTouch technique so that you can address your grandsons, your family members with this problem. Hello, Paul.
Hey, my name's Paul.
Finally came on this side of the camera.
We always make a joke. There's the Mondays with Deb and Paul show, but we're reversed. She sits on this side and I sit on this. So the workshops, it's the Paul and Deb show.
Right.
So we're going to give you a little workbook, and then we're going to start teaching some points. We're going to talk a little. Some of you have never done BioTouch here.
Right.
Some of you have. So, what we've done on this first page is give you a little synopsis, nowhere near what we got with Kimberly. That was wonderful. And it just brought to light how there is other things to do for this situation. I'm sure Kimberly will hang around to answer your questions about what she does, which is why we were grateful to have her come here. With BioTouch, just so you know, a couple of my experiences with it. First of all, worked with a drug rehab counselor who used to love to bring BioTouch into the drug rehab because his statement was, BioTouch just raised dopamine levels. That was his statement. And so you saying that was just like, I mean,
Yeah.
we don't have the scientific proof on that, but he just really felt BioTouch reached that, just like a drug. You thought, wow, this is great. And when you have people get BioTouch, their first thing they always say when they're done is, wow. Because as you'll see, that gentle, light touch, non-invasive, as you were talking about, it's sort of like that direct line. And a couple of times I've worked with children that had ADHD, I just remember this one child who was off the wall, and his mother brought me to the house. And so I worked on him, and I did basically what we're going to learn tonight. And then I took Mom, and I took her, and we worked on her, and we came back out, and she's like, oh my God. In the 10 years of his life, he had never sat quietly by himself and played with his toys for 30 minutes. And I was like, wow, that was just one time working on him.
Right.
Now, the problem was getting her to learn it and do it consistently. All these things, and I'm sure even with what Kimberly does, it's about consistency. This is not going to be something that we're going to teach you that you slap these kids or adults on the forehead, they fall over, and all of a sudden they're healed.
Right.
It's about consistency, and that's why we're really grateful to be able to teach this to all of you who have family members that need help, and then slowly teaching, even people that with ADHD can do BioTouch. Right. This is a simple technique. This is a no-brainer technique, and I've proven that one.
All the time.
Yes. So what we've done, and Bev's going to take us through the first page. This is a workbook. This is what we've done is take the basic sets of points that are needed to address a particular condition, in this case ADHD. It comes from our manual. That's our manual over there. That's the whole system, all the points in that chart up there. But we felt a lot of people don't want to learn the whole technique. You know, they have a very particular condition they want to address, like this one, ADHD. So what we've done is we've pulled this out, and we'll tell you more about the manual itself and the website and stuff. But we do want to just start moving into how to learn the technique. And we'll do that by just opening up your workbook here. And Bev will start taking us through what is the technique.
What is BioTouch? So how many of you have actually learned any of the, I know Rebecca, you have, yeah, you, Barbara. But have either one of you ever had any BioTouch?
I've had it done to me, but I haven't.
But you haven't actually learned any technique. Okay. So, well, we're going to do that for you tonight. So what is BioTouch? It is as Paul said, non-invasive. It's a very light, what we call a butterfly touch. We touch very lightly on the skin. In fact, if you want to reach over to your neighbor and just touch them very lightly on the skin like a butterfly. Yeah. That's just about the pressure that you're going to use. And what's amazing is that the lighter that we go on the body, it just lets the body begin to its natural sense of healer, because we recognize our bodies as the power of the healing. We don't use those kinds of words. We try to stay away from healing and, all of that kind of stuff, because it just gets in our way. BioTouch is a very, very simple technique that anybody can learn. And the beauty of it is the moment that you learn it tonight, you're going to be immediately effective for someone else. There's no levels for us or going through any of that stuff. It's just, you're going to have it tonight, the moment that we teach it to you, and you're going to be able to go into the rooms and practice it a little bit. So very light touch. There's specific points on the body that we will be touching to address any condition that the body can manifest or the medical science can name. We've had amazing results. It's a very powerful technique, and it's really based on a relationship of healing. It's based on love. And what happens in that love after a while through that consistency is it begins to open the body up to all of the other possibilities. And so tonight, when we teach these sets to you, and you're going to learn how to address with these 4 sets that ADHD, anything related, as Kimberly was saying, this is a whole spectrum of things that you can learn to address with what we're going to teach tonight. So who can learn it? Who is efficient? Everybody. Paul and I, and he is known since he founded this foundation and brought it into humanity's consciousness, is that this is a gift that's meant for all of us. This is that we're all inherently able to do for each other. It's all about caring. We don't have an intention. The intention is just to be in the presence of another human being and care enough to do BioTouch with them. So it's all about that. It's just about us saying, we're here to serve each other. We're here to love each other and to care about each other. And BioTouch is this amazing gift that we can give to each other with that touch.
So part of that, let me share this about, it came from a mining engineer in Colorado. We don't talk a lot about the history here. We have it in a book there, BioTouch, Healing with the Power in Our Fingertips, about my history of meeting Norman. But did want to bring up what you were talking about here, because one of the things that happened, this was back in 1988, we were teaching people in this little town in Maine, Colorado, And this old-time ex-CIA agent says, he'd been involved in a lot of revolutions in his life, but he'd never seen one that was as effective as what was happening in this little town in Mancos, Colorado, with teaching biotouch. He said, because this one was based on love. And we thought, wow, that really opened my eyes and really committed me to wanting to get this out to people. He said, your greatest difficulty is going to be how to pass on that simplicity and that purity. And that's why we have these classes, because the purity is within the technique itself. And the idea, as Bev was saying, there's no levels, everybody's effective. Those are new concepts in the world of healing that we could go out to anybody on the street and teach them, and they're going to be effective.
Yeah.
So
the other wonderful thing is that it was reminding me of some of the things that Kimberly was saying, that we used to say that we're a complementary modality, which we are. It complements everything else, whatever that is. Any allopathic procedure, regimen, any other modality, any other practitioners you may be going to. But what's beginning to happen that we're recognizing is that it is integrative and holistic. And the reason we can say that is that light touch on the skin begins a whole series of what we call self-awareness, because with that consistency, over time, the body itself will begin to respond to its own innate sense of bringing it back into a wholeness, bringing itself back into a balance. And we do not diagnose, we do not suggest, we do not say anything to our recipients about what they should be doing, what they shouldn't be doing, because believe me, we have seen it many times. That body will tell them. And so we're always encouraging everybody, if you're working with a doctor, because there may be some changes in your body that BioTouch is going to begin to make happen. And if you're not really paying attention, we don't know what's going to happen. So it's always a good thing to, as Charlotte knows for sure. I mean, we've had so many people with blood sugar issues, and BioTouch over time starts to regulate that blood sugar, and wow, like what's happening? Go to your doctor and he's like, oh wow, what is happening? You have to lower that insulin intake. So we have to be BioTouch helps us to participate in this healing process. And as we have a recipient, which is the one that's receiving the touch, and then the associate or practitioner, the one that is giving BioTouch. And in that, we have seen that BioTouch takes away the separateness. The very fact that we step in with each other as equals, because I know as a practitioner, I'm going to receive whatever I need from that session, because we're so interconnected. Humanity, we're all so interconnected. And so BioTouch allows us just for a moment, without any intention other than loving and caring about somebody and their suffering and pain, to step into an opportunity to honor them, and we both give and receive. It's so equal. It's just an amazing gift. So everybody do it. Everybody's entitled to do it. We know that everybody's birthright is to be healthy. Healthy is happiness. Healthy is wealth. This is, we all know that if we're out of sync in our bodies, our lives are just not very productive, and there's no quality going on. So this is one of the possibilities that this technique can offer us. So it begins on the skin, begins with the body. Why? Because we all have a body. We all recognize each other in that body. But BioTouch over time will take us all onto that journey and encourages our body to open and to process in a different way the possibilities of healing. And that happens mentally, emotionally, and physically. So it is very holistic. So what we do before each session is we wash our hands, and then we do what I'm going to teach us tonight, a set called the greeting. And we hold each point 6 to 8 seconds using these 2 fingers touching very lightly on the skin. That's it. We really don't have, there's one rule that will just blow your head off, but that's, yeah. And everything else is just follow the technique, and you're going to be immediately effective.
And not just effective, but you'll be able to teach other people. So
Yeah.
if these people are in your family, or if they're your kids or whatever, it's something that what you get tonight you can pass on. It's not something that only you're going to be able to do. Right. So there's the other there's no initiations. We're not going to give you something that you have to get from a master. The only master I am is how to drink beer and eat pizza.
Yeah. No clearing your space, no
Right.
clearing yourself.
It's
Our show was what, a week ago? Can you get other people's stuff? Not in love. You can't get other people's stuff when you are practicing a relationship of love. It's impossible. So, so that's what happens, and then we begin to separate ourselves. I'm a this and you're that, and I'm going to do this on you. Instead of, no, we are going to step in and start working together. That's what I really believe I am as a practitioner. I am just stepping in as the other half of a relationship, and whatever happens there is I'm getting as much back. So,
any questions so far? But yeah.
Okay, you say, we're helping the other people, but does it go backwards? Like maybe people have been working on other folks and end up the cold clears up? Or?
Right, that's what she was just saying.
Like you're touching someone for their whatever, and you find out that you walked away and something inside of you has gone away.
Because it's an energy shift.
Right.
that has actually happened.
Yeah.
Okay.
And that's what happens in that equality. Yeah, because Paul has said it many times. The recipients that come, say, to me, they've got something for me. I'm helping them with that journey of biotouch, but boy, they're going to have something for me to have an awareness about myself also. Yeah, I've actually had a knee problem, and I knew when I was going to come in here and work with recipients, some of them have knee problems. I swear, I'm giving a testimonial that I walked out of that room after about the 3rd recipient, and my knee problem, it was gone. So
it really becomes that fine line between who's the other, who am I, and you start getting into a whole. We had one guy from France that liked our presentation because we kept it simple. He said, he's heard a lot of quantum physics. Quantum physics is huge right now. Energy work is huge right now. A lot of energy modalities. There's even the university is testing your energy level, and they're going to start putting a rating on energy healers very soon because they want to receive insurance money for that. So they have to document it. So what we need with BioTouch is all that stuff might be true and might not. I can't prove it. I'm not a quantum physicist. But I do know that this touching is effective, and that the reciprocity of me helping you, you helping me, just happens. And even talking about love, it's not something we have to do. I don't have to go into a session loving. I can go into that session hating you.
yeah.
Or just read something in the newspaper and I'm just pissed at what's politically and globally or economically. But you know something? That's why I was excited about BioTouch. Just doing what you're going to learn, the greeting, bypasses the whole thing. I don't have to be knowledgeable. I don't have to, what Kimberly taught me tonight, I've been doing this for 30 years. The first time I knew anything about what's going on physiologically.
Right.
But I didn't need to know that. Now it just helps me understand, but now I've got to be careful. I don't want to take that understanding and start putting that into the BioTouch. So that, oh, well, let me tell you what we're doing. It's working on the neurological synapses and the quantum physical, da, 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 da. And, no, we still have to, you don't have to know all this stuff. It's nice information, but it's not necessary. And then you start seeing the reciprocity. You start seeing how, I'm actually 98 years old.
You act like you're about 50.
Yes.
So can you do it on yourself?
Good question.
We get that every time, don't we?
The
What
technique,
was the question?
can you do it on
On
yourself?
yourself.
The technique called biotouch is one person touching another on the skin, lightly as a butterfly.
Yeah.
What you do from that point on is up to you. If you try to do them on yourself and you're effective, great. If you're not, great. It's maybe a 50-50. It's very hard sometimes to dissociate ourselves from our own pain. It's like tickling. Can you tickle yourself?
Sort of.
Ooh, I'd like to see that, but I have not seen somebody who can tickle himself yet.
themselves.
But it's sort of that thing. And
You can feel it start tickling.
when you start rolling it, let me see what happens when I do it too. Oh! So anyhow, that's how the technique's done. Some people do the points on themselves, but that's not what we teach. We teach one person touching another because we know that that's consistently effective. It breaks down me having to worry about my own pain, and then it also requires me to ask for help. That's a big part of healing.
Yeah. Yeah,
When
it
I have
really
to
is.
ask somebody to touch me, or I'm in a relationship, or I have to do it to my grandkids, or teach my my
Become
daughter or
vulnerable.
my son how to work on their kid, and so we start creating a lineage, and we get out of our little isolationism that we're creating all over the planet.
Yeah.
So BioTouch is breaking the isolation.
It really is, isn't it? And the beauty about it, just to kind of expand on what Paul was saying, you don't need to know the anatomy. That's the thing. We're not really, it's not so much, it's area that we address. It's like, where is the pain? What is going on? And those 17 sets of points will address, for instance, anything that can happen in the lung area, we're going to do the lung set. We need to choose one or two other things to complement that, but it doesn't matter if you have emphysema, COPD, a lung infection, lung cancer, we're going to do the lung set. That's what we know, that's where the issue is, and that's what we're going to address.
Well, and like tonight,
Yeah.
whether it's the autism spectrum, ADHD, PTSD, anything that's related to the brain,
We're going to do the headset.
We're gonna do the set you're gonna get today.
Right.
Concussions.
Yeah, all of those things
All
you're
of
gonna
it.
still
Depression,
use these
you name it.
points.
Yeah.
But we picked this ADHD because we wanted to focus on a particular symptom
Right.
or a diagnosis.
Bless you, Kimberly.
But all those anything that happens in the brain, you're gonna do the same set you're gonna learn tonight.
Right.
So
Yep.
so let's teach some more.
Let's do it. Okay.
We don't have any way of cooling it down at all, do we?
Well, we have a problem.
It either gets freezing in here or it's, and right now it's hot.
Real loud.
So let me see what color this is. Okay. All right, so now we're going to learn the 4 sets that you can use to address ADHD. And the first thing that we're going to do is learn what we call the greeting set. This is a set that actually begins the process. It brings that relationship into a harmony with the practitioner and the recipient. And it really it's the key that opens that says, okay, now we're going to start doing BioTouch together. So it's the greeting. This is going to be the only set that we're going to use one hand. There's only 2 points. One hand, and that's going to be your dominant hand. So if you're right-handed, if you're left-handed, you're going to use your left hand. So we're going to always start with that. Again, very lightly on the skin, holding each point 6 to 8 seconds. And that's going to be it. So I'm going to come over here since I'm right-handed, and we're going to locate right in that soft tissue just below the breastbone is that little soft tissue right there. You're going to hold 6 to 8 seconds right in that soft tissue, just below the breast sternum. That's point 1. In point 2, we're going to be on the back of the body. And we're going to locate at the base. It shows in the diagram that diamond. We call that the big bone. Rondi would call it the C7. We're going to locate that. It's right at the base of the neck. Kind of like if you bend your neck forward, it'll pop out. We're going to be going to the left of that big bone about 1 to 1.5 inches, and we're going to rest lightly for 6 to 8 seconds on that second point of the greeting. And that's it. We're going to do that every time. It doesn't matter if you're doing 1 set of points or 3 sets of points. Always do the greeting before you address any other parts of the body. It's really important. It's the key. Any questions on the greeting? Very simple. The next set that we're going to do is the head set.
So something that everybody should know is what we've done is it's not the way they are in the book. We've given you in order, the order of preference. So if you were only going to do one thing, you do the greeting. If you then had more time, then the head would be the most important. So it's in order of importance depending on the amount of time. All 4 of these sets are, can be beneficial as a group of things, but if you just have one thing to do, then it would just be the head
We want to
set.
do the head set. Right. Good point. Yeah. So the head, again, we use this to address any condition related to the brain. And that includes chemical or hormonal imbalances. Anything misfiring, whatever it's going to happen. So we're going to, it's going to be tricky. I hope I can do this okay so you guys can see. First step, we're going to be touching what we call through the head. So you can follow along in the diagram. So point A on the back of the head is right at the base of the skull. And we're going to rest 2 of our fingers on that point. And then we're going to come and we're going to touch on the front of the head, right on the forehead, the centered forehead, where it begins to curve back to the crown. So we're holding on the back at the base of the skull, and we're touching on the front. That's the step 1. So we're actually through the head. And then you can begin on either side of the head to work. So we're going to locate what we call a hold point. So this is where you're going to be holding consistently on the skin while your other hand will be touching other points. So we call this one that's stationary a hold point. So hold point is going to be on either side of the head, right at the base of the skull again, to the side of that A point, right next to that large muscle on the neck. And we're going to be holding that. And we're going to be touching points on the opposite side of the head. So we're going to locate the outside corner of the eye and this ridge line that runs around the head, and we're going to be holding for 6 to 8 seconds on point 1. We're going to follow that ridge line back. Point 2 is going to be right above the front of the ear. Point 3 is on that ridge line, just above the back of the ear. Point 4 is there is a definite indentation in the skull. It's about 1/3 of the way down from the top of the ear. about 1 to 1.5 inches from the back edge. That's going to be point 4. Another way you can find it is you can place your fingers here, go up the back of the head straight over, and you're going to come right into that indentation. That's point 4. Point 5 is then opposite of your whole point. Now that's going to become your new whole point, and you're going to do the same points on the other side of the body. So again, point 1, going to stay right on that ridge line above the outside corner of the eye. Point 2 in front of the ear. Point 3 in back of the ear. Point 4 is that indentation in the skull. And point 5, opposite the whole point. So that's step 2. Then you're going to touch those same points in what we call matching fire, which means you're going to be touching points 1 and 1 simultaneously. Again, points 1 and 1, staying on that ridge right above the outside corner of the eye. 2 and 2 in front of the ear. 3 and 3 in back of the ear. 4 and 4, again, that indentation about 1/3 of the way down and 1.5 inches from the back edge. And then 5 and 5. So you're touching the same points, just touching them in different ways. In the last step, you're going to take your open palms and you're going to be placing your thumbs along points 1, 2, and 3 on the head. Very lightly. And that's the headset. It may seem a little complicated, but it's, again, you're only touching 5 points on the head. You're just touching them in 3 different ways, which happens in a lot of our sets. So any questions?
Just to remind people too, we're going to practice these points on
Yeah,
each other.
definitely. So, I know. Oh, surprise. Not you, Rondi. Not you, Rebecca. Okay, so any questions on the headset? Okay.
So it's interesting, those points in what Kimberly was talking about, that the base of that skull, I forgot what you called it.
This,
You want communication from the front to the back,
Right.
back to the front.
yeah,
And so touching the back there, the whole point, and the A
and it goes
A.
right along that ridge, doesn't it?
Yeah. So it was interesting hearing you.
I know, yeah.
All that needs to get, and then communicated, so.
Right.
That was interesting.
Yeah, I thought so too. So the next set that we want to introduce you to is the metabolism set. This is just helps the body to, rid itself of what it doesn't want and assimilate all that it does want. So it's a great set for helping to regulate the body in many ways. So this is 2 steps. The first one, we're going to be working just along this large muscle on the front of the neck. And we're going to be working, remember in matching fire, how we did on the headset? We're going to be touching 2 points simultaneously, symmetrical to each other. And we're going to begin this indentation just above the collarbone. We call that point 1 and 1. We're going to touch lightly, holding, again, 6 to 8 seconds. We're going to go halfway up the neck. We're staying on the front of that large muscle. And then points 3 and 3 at the top of the neck, in front of that large muscle. Now you can always repeat points as many times as you feel you want to. You can do them 1 time, you can 2, 3 times, whatever it is that you feel you want to do. So that was the first step. Now we're going to be touching points on the back. The first thing we're going to do is find our whole point. So we're going to imagine a line that runs between where the nipples would be on a youth. Okay? We're going to do that, and then we're going to locate on that line. It's about 1/3 of the way up from the greeting point 1 on the breastbone, and we're going to be about 1.5 inches to the left of the breastbone. That's going to be our whole point. Remember, I told you that was, your fingers are going to rest there, have constant contact with the skin, and then we're going to be touching some points on the back. So we use a reference point. It's called what we call the breakover. It's where the natural rib line joins the spine. It's straight through the body from greeting point 1, straight through the body. So we're just going to use that as a reference. And we're going to be staying below the shoulder blades and above the hips. So point 1 is going to be 1 to 1.5 inches above the breakover point on that left spine muscle. We're still holding on the front. Point 2 is directly across on the right spine muscle. And then keeping in mind this breakover point, we want to, for point 3, we want to be 2 to 3 inches on that right spine muscle. Just those 3 points. And you can touch those the whole time. Okay, well, let me do this then. So that spine muscle, we want to be right there, staying above the hips, about 2 to 3 inches below that breakover point. And again, you can touch these points as many times as you want to. And that's metabolism set. Any questions about that? You'll get a really good feel for it. We had somebody that was in our last class, and wow, that looked really kind of complicated. But then she says, I went into the room when we practiced, and wow, it just came to me. It was just wonderful. It's so, and that's what we feel, that BioTouch is so innate in all of us to be able to do. The last set that we're going to do is really easy. It's the neck set. And the reason that we really included this is because from that big bone or C7, we know that all of the nerves that go into the neck and the head are the source here. And then, all down into the upper extremities as well. But all of these nerves we can really address with the neck set. So very simple. We're going to be working in matching fire again. Okay, all right. So we're going to be working along that muscle. Points 1 and 1 again in the center of the neck. Points 2 and 2 right in that indentation at the base of the skull. So we're working along that large muscle. And then 3 and 3 at the bottom of the neck. And that's it. And you can address all of those nerves into the brain with the next set.
Is there another set for the eyes for someone that has glaucoma?
Oh, well, yeah, you should have been at our last. What was it, one before, right? We had a workshop on glaucoma.
Oh, did you?
The eye set's wonderful. It's very easy. Yeah, wonderful. Very effective.
So,
Ronnie, yeah.
How often do you recommend this treatment for a child that has just?
That's a great question. For an adult, we always say, listen to your body. What's it telling you? How often do you think that you to have a BioTouch session to address whatever condition? If you're dealing with a young child and you're the parent, BioTouch cannot hurt anybody at all. It's so totally non-invasive. So as a parent, if you feel like your child could use it once a day, once a week, that's going to be your call. I certainly, don't feel like there's a set amount. Every body, we all have a body, but every body is different, and every body is going to, have its own reaction and deal with biotouch. So this is your opportunity as a parent or caregiver, whatever, to, step in and trust that relationship.
So another thing that happens is you might only get a few seconds. I remember working with this child who was jumping on the table, pulling down the curtains, had these huge glasses, and I could only get a minute working on her. So the greeting wasn't even 6 to 8 seconds. The head, I was running around the room doing her head. I think it was by the third session, she was sitting on the table for the full 20 minutes, and I was actually able to do the eye set on her without her jumping around. So, getting the greeting is the key.
Yeah.
And then you just sort of build on it based on who it is you're working with and how much.
In response to the individual.
Right.
And we had 3 children we were working with, and all 3 children we were told by the parents were getting better. But we couldn't get them to do it. And then they did a new drug and they went back to baseline.
Yeah.
They never came back again.
You know what else came to me? Because children are they really are intuitive within themselves, even if they have other situations that maybe we're not perceiving that. And I think biotouch is just so innate with all of us. I think if you're working with your child, they're going to let you know how often they need it. Because once they start getting it consistency, they will say, "Can I have my biotouch, Mommy?" That's what's going to happen.
We drive by, and my daughter will go, "Oh, biotouch."
Yeah, because you brought her to one of the classes. So I think in many cases that child is going to let you know what they need. Because biotouch will open them up in many ways to what is it that I require.
So why don't you say goodbye? We're going to tune off here and then we can answer more.
Okay. Well, thank you for joining us. I hope you learned a lot, and we're here. Contact us if you want to know more.